Good morning, everyone, and welcome to the Heart Failure Quality Exchange Call. My name is Michelle, and I'll be your moderator for today. Feel free to ask questions throughout the presentation by typing them into the Q&A box on the right-hand side or by unmuting yourself by *6. The slides and a link to this recording will be provided within 1 or 2 weeks of this presentation. I will now turn the presentation over to our Regional VP of Quality, Sherry Boxberger. Sherry, the floor is yours.
Good morning, everybody. And I see from the list of attendees, we even have some of you from Mountain Time. So thank you for getting up so early to join us on this quality exchange. And just for some of you may be new, we in the Southwest affiliate, and I'll talk about that quite a bit, American Heart Association is divided up in affiliates, and ours happens to be a 6-state affiliate. And so we provide quality improvement services across those states. So that's Arkansas, Colorado, Oklahoma, Texas, New Mexico, and Wyoming. And so we decided that we wanted to be able to have an opportunity for our customers to kind of get some updates once a quarter, and then also to be able to interact with one another. So oftentimes these meetings, if you've been on before, I'm kind of begging you to participate. But I tell you, that little box, that Q&A, works beautifully, and you can type comments and questions in there, or at any point, just *6 and ask a question or share something that you've been doing at your hospital, because that's the point of these programs. This is the first this week. Today, over the noon hour, we'll have the topic will be stroke. Tomorrow morning, the topic will be resuscitation at this time on Wednesday. The lunch hour topic tomorrow is atrial fibrillation. And then Thursday morning, coronary artery disease. So we have these available across the continuum of cardiovascular disease and stroke. If you want more information on any of those, you feel free to pop us an email at SWA, that's Southwest Affiliate, SWAquality@heart.org. So anyway, let's hop in for today. This is our agenda. We are going to kind of see how we're doing after the first quarter. We realize the majority of people probably don't have all of their data in for Q1, but this will give us an idea. As you know, this is abstracting for heart failure can be a burdensome stone. So I want to talk to you about the potential of creating uploaders. We have quite a few hospitals across the country who successfully had their IT department create a CSV file, that's comma separated value, so what CSV is, file, so that some of the data can be uploaded and then you can just fill in the rest. We'll have a wonderful heart failure research update from my colleague, Christy Esposito. And then I want to give you a demonstration of HF Path, a wonderful tool that you can introduce to your tech-savvy customers, patients, and their families. It actually has a support group feature. So I want to be able to show that. And then, of course, we're going to look over important dates that are to come up. So, and if there's anything else you want covered, just pop it in that box, and Michelle will keep us on track. Now, this is a chart that you see every month because the concepts behind Get With The Guidelines are to assure that patients are receiving guideline-directed medical therapies. And as you can see, and these match up with many of the measures that are achievement and quality measures, and you can see from these numbers that these have the evidence that they actually save lives. They actually reduce readmission. And so that is why we're always looking at your numbers and seeing how you're doing on ACE, ARB, ARNI. Are you getting those evidence-based beta blockers out? And why we're actually asking these questions. So we will always start with the evidence. And these are the things that, among others, that we're working on. And so we do still have a good number of hospitals in our affiliate who have not put data in. And I know that as we're wrapping up the year and we were talking with all of you about your awards and your 2018 data, you may have gotten behind. If you're one of these hospitals, I would encourage you to think about the CSV uploader. We'll talk more about that. Already we have a good number of hospitals that are on track. They're heading in the right direction to be recognized as high-performing heart failure centers. Here we are in our Q1 data. And this is, of course, only for a quarter, and some of you may not have a whole quarter in, but wanted to be able to show you this. You should have received a report from your quality improvement director. We, on a quarterly basis, all the directors across the Southwest affiliate put our out of office on, and we run your reports so that you are on a quarterly basis seeing how you're doing so far, and without taking any of your precious time, being able to see what's going on. So this is what we were able to accomplish off the Q1 data. Looking at 94%, we ended the year on ACE, ARBS, or ARNI from the Southwest affiliate at 91%, and then Q1 we are at 94%, so an improvement. Also an improvement on evidence-based beta blockers, where the aggregate for the year was 90%, and we're at 93%. And you can see we're hanging about the same, very high in LV function. And then that tricky and very difficult measure, although hopefully we've made it a little easier, the post-discharge appointment for heart failure patients, where our aggregate for last year was 71%, and we're at 81% across the affiliate. So we are really already hitting the road in a positive manner with these achievement measures. Now, you know your plus measures. And we didn't include things, I don't think those are 2 pages, I forgot here. Yes, okay, sorry. So the plus measures, I'll be going through those. Now remember, aldosterone antagonist, although it is a quality measure, or what I'll call a plus measure, it still is a class 1 recommendation. And so I was really glad to see that we're hitting the year strong in that. We actually have some groups that are only focusing on aldosterone antagonists. They had to pick one thing as their grade card, and that's aldosterone antagonist. So starting the year at 58%. ARNI continues to grow, and I know that's difficult. We reviewed last time the latest study that demonstrated that it is safe to be able to start ARNI from the hospital. It doesn't have to be done outside of the hospital after discharge. So that's continuing to grow. We know we have such huge benefits that have been demonstrated with that drug. Going across, CRT's up also. I'm not going to read all these to you. Up with the follow-up visit. And for anyone who's new on the call, just want to reiterate the difference between, and I'll just go back there, the difference between this post-discharge appointment for heart failure patients and 7-day follow-up. 2 distinct measures. The achievement measure stands alone, and it says that the patient had their appointment in their medical record at the time of discharge or very closely thereafter that included date, time, and location. Follow-up visit within 7 days, again, stands completely alone. Did that appointment occur in 7 days? So you can see that a patient can actually be compliant in one or the other or both, but they're not dependent upon one another. So 2 separate measures, and that looks like we're down a little bit, so I'll be interested if there's any feedback as it relates to the 7-day appointment. And let's see, our immunizations, of course. Most of you have that under control. Here we are on our honor roll, which, of course, the different measure here is referral to a heart failure disease management program, which has a very specific definition. So it can be cardiac rehab, it can be 60 minutes of education, it can be, but it has to be a heart failure specific program. So many of you on target there. All right. Does anybody, we are just getting started, and it is true that this volume is low. This will continue to increase the ends that we have. Anybody have any questions, concerns, things they're working on as it relates to measures? You can type them in, and I'll get over here where I can see them, or I'm going to close my attendee list. Okay. Anybody else having trouble hearing? I'm hearing from my colleagues. I'm going to turn it up here. I apologize. Maybe my headset is conked out. Thank you for the feedback, Sarah. All right. Now let me just make sure. *6 if you have any questions about measures. Oh, I have a typo there, and you're going to see it on all 4 pages. I apologize. Let's go into CSV Uploader. The concept of a CSV Uploader is for your IT department to be able to go out to your EHR, or if you have some other source of data, and to be able to pull in the right format data so that we can upload it in to get with the guidelines. And you actually do this yourself. You don't have we don't have to do it for you. When you go into your into the PMT, and that's short for Patient Management Tool, then you would go to this section called Data Upload. And when you actually have your file, this is how you'll do it too. And then select CSV Uploader. And then in this tricky place, that's why I have circled it here, if you click here, that's how you get the document that you need to share with your IT department. And it looks like this. And it gives coding instructions for your IT folks to be able to say, these are the fields, this is how you would format it. And the concept, let me go back, is that once you have that there, you would literally choose your file, decide what dates you want to upload, and you would upload them. So, and say that you can only get 10 or 15 things to come across: date of birth, time of admission, some of the numeric, they call them discrete elements. It would still be a savings for you because those are all things you don't have to put in. And because we know dates and times can be slower to enter, just being able to upload those dates and times could be a benefit to you. So if you are interested in trying to pursue a CSV uploader, I encourage you to click here when you go into your own system. You'll end up with this big document, and I forget how many pages it is. It's a lot of pages. And the IT people will be familiar with it, and talk to them to see what data elements you might be able to pull into your system so that your abstraction time is less. And we have this available for all of the Get With the Guidelines tools. So please visit with your director, or if you're not quite sure, then ask SWA-Quality@heart.org. Sorry, I'm trying to read messages and stuff. SWA-Quality@heart.org, and we'll tell you who can work with you. But this is worth looking into it for each of you. I am going to do a sound check. I have one person. Some people are telling me they can hear, and some people are saying they cannot. Can somebody who's not an AHA person let me know how your volume is? Type it into the Q&A and give me some feedback on that. Teresa, you asked, is this something that's available to all hospitals? Yes. Now, I will tell you, oh, thanks. I'm getting feedback that we're okay. Sarah, I think you may just need to dial back in. Thanks so much. This is available to all hospitals. I will tell you that for those of you who are in HCA hospitals where that's more dictated down from national, we don't yet have a solution. Normally that has to be something that's approved by your national office. But we have successfully used this tool with almost every other system. So, yes, Teresa, that's something that we can definitely work with. Thank you for all of you telling me about the volume. That helps me because I was afraid I might need to log out and log back in. Any other questions about CSV Uploader? Is there anyone on the line who's actually using it? I know some of our partners, Providence and Waco, finally got theirs working, so I don't know if it's actually pulling in data yet. If there's anyone on the line who has done this, who might give a personal testimony, let me know. *6, or you could just type it in and I can read off your comments. All right. Well, I'm happy to hook you up with other hospitals that are doing this. Larissa DeLuna on our team, who is kind of our health IT lead, it really has skills in this area, so we have some resources for you. So let your director know you want to pursue this. This is a good time of year to get this working so that your whole year can be abstracted with less time and effort. And, of course, whenever you can get your data in quicker, you're going to be able to use it for quality improvement in a better way. When you're not able to put data in a timely fashion, then it becomes more of an award program where we really want this to be a quality improvement program where you're making changes and getting the care for your patients improved. All right. I'm going to just double check. Okay. All right. Looks like we don't have any further questions. Just so you know, give you an idea of what happens in our data days, which was last week, is that all the directors across the Southwest affiliate actually sent out last week 481 reports. I hope you find this helpful. If there's something that you would like to see changed or now we realize it's always a snapshot. You're not getting your whole quarter. So we're definitely open to your feedback and would be interested to hear how you're using those and how it's helpful or how it could be changed. All right. Well, I am excited to turn the presentation over to my colleague, Christy Esposito. Christy is not only the director for North Texas, and she joined us last fall, but she also has taken on the role of module champion, which really means that she's keeping her finger on the pulse of heart failure research, what is going on. And so I've asked her to just share a few of the studies that came out of some recent scientific meetings so that you can learn a little more of what's there. We certainly can have these studies available for you, and if there's something you'd like to know more about, let us know in the Q&A, or we can you can talk to your director about it. So, Christy, I think I could turn it over to you, or I guess I can move your slides if you'd rather. What are you going to do, Michelle? Are you going to turn it over to her?
Christy, you have control.
Yes, I do. Good morning, everyone. Thank you, Cherie. All right. So, like Cherie said, I wanted to give you guys kind of some of the latest in heart failure research and care that came out of both our scientific sessions and then Q-Core. So the first one, let's go ahead and get started. Sorry, I'm trying to figure out how to move the slide. Okay, it said I have control, but I don't.
On the right side, you should see a number with an up and down arrow.
Mm-hmm. There we go. Okay, sorry about that, everybody. I've done it once before, and it was in a different spot. So, okay. So this is the first one. This actually came out of Q-Core, out of scientific sessions. And this one here, this was called Few People with Heart Failure Take Guideline Recommended Drug, Especially If Not Started While Hospitalized, which this is something that obviously we probably already know. But I found this study particularly interesting. This was a little bit of a larger study than the ones that we'll talk about out of Q-Core. So I want to give you a little background on this first. So in 2016, the AHA and the ACC issued a focused update to heart failure guidelines that reflected newer medication options, and that included ivabradine, which has more recently been proven successful in helping to improve outcomes of heart failure patients, including reducing rehospitalization rates. So this current study called PRIME-HF evaluated 104 patients. There was an average age of 58 years old. 36% were women and 64% were African American, so it was a very diverse study. And these were patients that were hospitalized across the United States at 23 different hospitals who had worsening heart failure and who were obviously good candidates for ivabradine. In the randomized open-label study, researchers compared rates of medication use 6 months later between those who were those whose hospital physicians were asked to initiate it prior to discharge, and then those whose physicians were instructed to provide the usual care with consideration of starting the medication during follow-up visits. So what they found was that 6 months after hospitalization, the researchers found that patients whose physicians were asked to initiate it prior to discharge they were far more likely to use it. It was 40.4% were still using it if they were started in the hospital versus 11.5% for those that were not started until after discharge. So those are huge numbers, very statistically significant. They also found that they had a greater reduction in their heart rate, and they did not develop abnormally low blood pressure or heart rate, which has been kind of a concern that some physicians have had as to why they're not starting it in the hospital and why they're deferring to after discharge. And they did not need to reduce their dose of beta blockers either. So this is a really interesting study. Definitely, as this medication becomes used more frequently, I think we'll have a lot more data about it, but it's important to realize that when we start our patients on ivabradine while they're still in the hospital versus waiting until after discharge, that we're reducing those readmission rates. We're not seeing that drop in blood pressure or heart rate that there were concerns about. All right. So that was out of Scientific Sessions. So the next ones that we're going to talk about, these were all from QCOR. One thing that I do want to kind of say up front is with QCOR, these were poster presentations. So these were typically on a smaller scale, typically, at one facility or so they're all very, very interesting, and I hope you guys enjoy them as much as I did. But I just want you to kind of keep that in mind, too, that, all of these, while they're a great jumping off point, we definitely will want to pay close attention to these and definitely look for more research in the future because they're a great start. So this first one here is predictors of patient self-advocacy in heart failure. This is something that I hadn't really seen before. I'm not sure how well you can see that final model over there, but this came out of the University of North Carolina. And the conclusion to this was that nurses have a direct relational role in helping their patients use knowledge to speak up. And that wasn't something that I had really thought about. So what they did here was that they looked at a patient's social support as well as the trust that they had with their providers and the number of touch points that they had with their nurses in the heart failure clinic in order to evaluate whether or not this made their patients more likely to self-advocate, to ask questions, to share with their physicians when they were having concerns. And I think that's a really important thing to focus on. So what it says here is that the implications from the study is that trusting providers and social support is important to patient self-advocacy. Interventions designed to increase trust in provider, increase social support, and social skills may have a positive impact on a patient's level of self-advocacy. So I think the important takeaway from this is just that for those of us that are seeing our patients in the heart failure clinic, you are making a difference with your patients. The touch points that you have with your patients, making sure that they're linked in, giving them. I know Cherie said that she's going to talk a little bit later about HF Path and some of the social support that they can get from that. And those are all key pieces to making sure that we keep our patients not only engaged, but making sure that we give our patients enough knowledge to feel comfortable asking the right questions. Okay. All right. So this one here, this was another poster board presentation from QCOR, and this actually was a local author. So this came out of the Baylor University School of Nursing in Dallas. And this was called Talk to Me About Your Medication Non-Adherence, Stories from Older Adults with Heart Failure. So this was less of a study, but more of getting out there, talking to patients. These were all patients over the age of 65 years old, and really evaluating if they were taking their medications and they were being completely adherent, as in they were following the instructions provided by their physicians or their clinic staff, and if they were not following those instructions exactly, what some of those reasonings were. And it was really interesting. If you have time, I'm sure that we can give you guys the link to go in and look at all of the posters from Q-Core. There's actually a search feature. But they have a lot of awesome quotes in there from patients. And one of the things that they found was that the patients that were non-adherent with their medications did not admit to being non-adherent, or they did not understand that what they were doing was being non-adherent. They felt that they were just advocating for their own health. And so some of the quotes, had things as like, okay, well, if I take my diuretic, I have to get up to go to the bathroom throughout the night, so I decided to take only half the dose. And the patients are like, that's been working for me, so everything's great. And there were a lot of those type sentiments of, well, I had this potential side effect and I looked online or I did some research and I felt really confident that that was the problem. And so without talking to my physician, I made the decision to adjust what I was doing. And because they feel like that was working, they would not classify themselves as non-adherent, which was very, very interesting to me. The other thing that they found was that they would not communicate with their with the physicians or with the staff that they were taking it in a different manner from what they were prescribed. They also didn't necessarily understand what medications they were taking for which reason, or even why the medications at certain intervals was so important. So the conclusions from this particular study is that assessments should aim to understand the actual medication taking routines and patient preferences. The development of interventions that utilize resources that are readily accessible to patients may promote decisions for medication adherence. So what that really is saying is just to have an open dialogue with your patients, be specific when asking if they're taking their medication, ask if they're having any particular side effects, ask if there's anything that, any problems that they're having, and make sure that we also educate to our patients, what medications they're taking for which reasons, and why the particular dosage or frequency is so important. Okay, and this one here I love because I get the pleasure of working with a lot of the heart failure clinic staff around here in DFW, and so this study here, the Heart Failure Clinic, Empowering the Armor Against 30-Day All-Cause Readmissions, this here was basically just looking at whether or not getting patients involved with a heart failure clinic after discharge was really making a difference. And if you look here at the results, I just want to assure you all that you absolutely are making a difference. The study revealed that there was a 67.1 reduction in 30-day all-cause readmissions following initiation of the clinic. And this was for patients that were seen at least twice in the heart failure clinic after discharge. So this really breaks it down based on who was involved in the study and what the findings were. But I think this is something that a lot of the facilities, at least here in DFW, we're very lucky that, we have heart failure clinics available to our patients. And it really is proving to keep our patients engaged and keep them compliant, which is ultimately going to help to not only lower our 30-day all-cause readmissions, which is something that everybody is focusing on, but it'll also help to improve the quality of life with our patients and improve their understanding of their condition. And I think I see that there's questions at the bottom. Oh, no. Okay. All right. So that is it. Those were my fast and furious top presentations from both scientific sessions and Q-Core related to heart failure. If anybody has any questions. I don't think I see any. Michelle, can you confirm that for me?
No questions, Christy.
Okay, fantastic. Well, then we will turn it back over to Cherie. Thank you, everyone.
That's great, Christy. And we'll include in the email, there's actually a link so that you can see, that's one of the great advancements in scientific meetings is that now the posters are all available electronically, and there's actually a search feature. So we will send that out with these slides within a week of this, and you'll have a link so you can go into those posters and actually type in heart failure, or if you want to put in a certain medication or you want to put in heart failure clinic or whatever, and you can look at those. Now, I want to point out that many of the posters that were at QCOR, and QCOR stands for Quality of Care and Outcomes Research Conference. It is an American Heart Association conference held each spring. That many of these posters were people just like you who were working on a project, a process improvement project, maybe as part of accreditation or as part of your committee with heart failure, and then they put that into an abstract and submitted it. And each of you could do this with programs or with improvement efforts that you're using. As I look at the list of folks who are on here, I know that, Amy, you come to mind there at St. Anthony's in Colorado because you've done some interesting things as it relates to hiring someone to help with your post-discharge appointments. I know that the Baylor Scott and White group is doing some things, so Esther and that group. So I see a number of you that are doing great things where you might want to submit an abstract. And we would love to help you with that. Just so you know kind of what's coming up, Heart Failure Society of America, they have their own kind of scientific sessions in that company. It's not American Heart, but many American Heart people attend. The abstract deadline for that is June 24th, and then their actual program, it will be approved, or if it was approved, it would be at September 13th through 16th in Philadelphia. The American Heart Association will hold our scientific sessions in November 16th through 18th, also in Philadelphia. I don't know what the story is with that, but we're all going to go to Philadelphia if you're going to do a conference. And the abstract deadline for that is June 6th. So think about what you're already working on. Hopefully, as you think about what Christy shared and then you go in and look at the posters, you're all doing this kind of research already, and your colleagues can benefit from it, and especially when it's in the topic of heart failure. This is our growing diagnosis. It's the most expensive diagnosis, and it's difficult to get patient compliance and engagement. So I encourage you, your director will help you on this. If it's something you're not sure how to start, just let your quality director know, or let us know at swaquality@heart.org that you want some help, and we'll sure do it. I also do want to remind you, any of you who did not participate or listen in on the webinar on February 11th, this is since we had our last quality exchange, there is a fantastic heart failure webinar that includes all of our national leaders, I think 4 or 5 speakers, and I'm going to send the link out also, so that's a wonderful thing for you and your colleagues to have. All right, I'm not seeing any questions, so we'll charge along. Oh, moved ahead. I want to log. Michelle, are they going to be able to see my screen, or do I have to do something different? I didn't think of that till this minute.
You will.
To do a demo. Okay.
Yep. So as soon as you click on the website, you're going to have to change your share preferences to share your desktop.
Okay. Share my screen, and I've got it here. Okay. Can you see that, Michelle?
Yes, I can.
Okay. So HFPath, and I've logged in here, and we'll send you the link, but this is a free tool. It's a patient and caregiver tool that you can, and I know there's only certain patients that might be appropriate for this, but it's a great place for the tech-savvy caregivers to maybe help with a picture, to help with a loved one, because this tool, which has been sponsored by Novartis, it's really nice. Now, I'm showing it to you on a computer, obviously, but I would say that the app is actually, it's super user-friendly. It's actually a little more complicated online, but we know some people don't do phones and apps. The concept is, and it's a wonderful guided tour, but the concept is for you to be able to create a plan, and what you're able to do with that plan is to be able, they're going to have a survey, your medications are going to be on there. So as you can imagine, this is something that you could do for a caregiver could do for their loved ones. The things that can be done are to keep track of blood glucose, their medications, when they're taking them, activity, etc. It also has a built-in quality of life survey so that we can be able to see how they're progressing. So when you look at, this is kind of your standard, I forget which one they've used, it's at the bottom here, but where you can really see how they're doing in the past month. Are they having swelling? Are they having to, sit up in a chair, or they can't get around the house, so on and so forth. So that's built in there. But what I wanted to show you also was that it has a monitored support group feature. And this feature actually, and don't be alarmed, we actually keep track of what's on there, and we look at what's posted so people can't necessarily, they can't give medical education. I do see there's a drug thing there, but they're telling how much they are taking. So this is a good opportunity, if you've got somebody who is like a computer person, for them to join and be able to talk to heart failure patients across the country. And there's some really encouraging things on here. They're asking, how are you doing with drugs? Somebody else was asking about CPAP. They just got CPAP. They're looking at norms. So anyway, this is something that where we in the hospital have fewer and fewer opportunities to have support groups. This is something you could get your folks involved in. And then, like I said, if they want to be able to keep track of their activity, like I said, this to me is much harder to do on a computer than it is on the app. So, but I wanted to, has anybody already used this at all or gone in? If you'll come off mute, *6, and tell us how you use it. We're going to be using it in a North Texas project very soon, where we're going to be deploying it with intention to a good group of folks and see about adoption and how it's helpful. Any questions or comments as it relates to HF Path? Well, I encourage you to take a look at it. Your director can also help you get some materials, so you can hand them a sheet that says this is how you get signed up, that kind of thing. It is available on the heart.org site, or we'll have the direct link off of it. And it's available in the App Store as well for Apple or Android. I realize it's probably called something else on Android. I'm an Apple person. All right. What do I do, Michelle? I got to get back to the slide. Oh, you did it. Thank you. And I'm looking here just to make sure we don't have any questions. All right. Give it a try. I want to hear from you. And don't forget about Guidelines on the Go. Everybody loves Guidelines on the Go. Your docs will like it. And remember, when you bring it up, you set it up for the disease state you want. And if it's pink, it means there's been a change. So it's a great way to keep track when they tweak the guidelines. Usually you know if there's a big change in the statements and guidelines, but sometimes they just tweak or do some sort of a focused update. And then you can find that by seeing that it's pink. It means you should check that out. There's been some changes. It's available in the App Store, so it's free. Guidelines on the Go. All right, important dates. The important dates we have coming up are May, very soon, which that's in 2 days. It's tomorrow, right? Or it's coming up. So May, you will be hearing whether you are eligible for your award. We are going to be notifying you that in the next few weeks. And so all of you who get a recognition will receive an ad kit. Very important for you to let your marketing department have access to this kit. In there is a press release that can be edited. We do need to take a peek at it if you edit it more than just adding your name. A certificate of achievement. There are little widgets you can put on your website, your hospital website. There's print ads that are really ready just to add your own logo. And there's a whole variety of the award icons, so that if there's things that you're wanting to do, posters and that kind of thing, those are available. There are a lot of ways that you can promote your awards, and I encourage you to do so. I've been doing this job for 9 years, and I have seen everything from a full-size banner, and I'm talking from the top of a building down 3 or 4 stories, where they announce their recognition. Obviously, smaller posters in the elevators. Many of the Houston area places will put their awards inside their elevators. Lots of opportunities. Those of you on the phone, how have you used, if you've been recognized, have any of you done some clever things with your ad kits or promoted in a way that you thought was neat? Feel free to type those in or just do *6 and tell us what you've done. Well, I am interested, if you have pictures where you've used it, maybe this year as you become recognized, show us what you're doing with those. I'm going to show you just so you know. So we have projected that we're going to have 20 gold pluses, 2 golds, 8 silver pluses, a silver, a bronze, and then 16 of the ones who have other awards will also be Target Heart Failure. So we, many of you are doing a fantastic job, and we want to get you the recognition you deserve. And just so you know, your director is willing to frame your award and come out and present it. The venues where we've done that include board meetings, leadership meetings, even just your heart failure team meetings. So if you're interested in doing that, we want to help you. Of course, we're wanting you to spend, yep, go ahead.
Yeah, we do have a story from Shelley. So she had her city paper come out and do a whole article on the group, and they also brought in patients.
Oh, I love it. And anytime you can incorporate those patient stories, that is great. Well, and that is a good point. And many times you are able to get media to come out or a newspaper article. That's wonderful. Great example. Are there others? Because we'd sure like to hear of them.
Yes, they also have Facebook groups for their hospitals.
Oh, well, that's a good idea. So you can get that interaction. As we talk about trust and some of those things, that does make sense to be able to incorporate that communication. We did hear a presentation 2 years ago, I think, at Heart Failure Society of America, how important using social media is to integrating with our patients, and especially my generation, I'm 55, the next generation of heart failure patients, where we are going to depend on electronics a lot. So great. Well, we're interested and want to see pictures. Send us swaquality@heart.org and tell us what you are, how you promote your award. We'd love to have it. Anything
Hi, Sherry.
else,
Before
Michelle,
we move on,
yeah.
I have a couple questions regarding the demo, the PATH demo. Just to clarify, it is available in Android and the iPhone store, correct?
Yes,
Great.
right, both Android. And I think the link, if you go on heart.org and in the search box put in HF PATH, the page comes up and it has the links to online, which is what I showed you, and then it has the link to the Apple version and the Android version.
Great. And are the patients' input monitored by clinical staff?
Yes.
Thank you, Sherry.
It's a monitored site. They will talk about clinical things. I've been on for the last month getting the notifications and just getting a flavor for it. And you'll see our coaches, it's called a coach. You'll see our coaches intervene and say, this is a decision to make by your doctor, please see your doctor. So you'll see that by the coaches that are over to the right. Good question. Good question. All righty. I love this interaction.
So I would love to add that we do understand that not all patients are tech savvy. Of course, we hope that they are, or that they have a caregiver that would be willing to do this. But there's also a lot of the forms from HF PATH, like the symptom tracker and all that, is also available in print form. A lot of that is out there at heart.org as well. So if you have a patient that seems interested in getting more education or in tracking some of these things but isn't necessarily tech savvy, you can actually print out some of those forms as well to provide to your patients, so you can still have that open dialogue with your patient and have them be tracking their symptoms and be aware of kind of what to look for and all that.
That's a very good point. Thanks, Christy. So your director is glad to help you. Just pop a note or swaquality@heart.org, and we'll get you your answer. So we're hoping you'll try to finish your quarter one data, be completely done here coming up soon. I wanted to remind you again of those abstract due dates on the 6th and the 24th. For those of you who are recognized as gold and silver, the U.S. News and World Report ad will come out. It probably comes out at the end of July. It's actually the August magazine that it's in. Of course, in July, we're going to send you another Q2 snapshot, the kind that we did last week. And then our goal, of course, is that quarter two be abstracted by the end of August. So those are kind of some upcoming and important dates. I think that's what I have, but we are interested. If anyone has questions, if you've run into any difficulty in your abstraction, if physicians are asking you of anything that you would like this group to weigh in on, our heart failure breakfasts continue. We had one in Denver a month and a half ago or so. Arkansas is moving forward with their statewide heart failure breakfast. We're about to re-engage with those of you in Oklahoma. That'll be coming up pretty shortly. So if you should have a regional heart failure activity. I know the North Texas group is kicking back off also. So make sure and ask your director so that you can certainly be on the list for those heart failure gatherings. We want you to know your colleagues in your region on heart failure. Let's see. I don't think I'm going to check my questions one more time, and then I'll let you go unless somebody star sixes. All right. Well, thank you so much for the hard work you do improving the care for our heart failure patients. If you've been around these patients, you know how sick they are, and they really need guideline-directed therapies, and you are the ones who are leading this nation and providing the best care to our heart failure patients. And as this population continues to grow with the baby boomers entering the age group where it's more prevalent, they're really going to need continued care and processes, clinics, methods to be able to take care of a large number of patients with as few resources as possible, and you're really leading the charge on that. So if you have any questions or need anything, don't hesitate to reach out to your director of quality. That's why they're there, and we look forward to talking to you again next quarter. So thank you so much for your time, and I'll give you about 12 minutes back. You can grab some coffee before your next meeting.
Great, Sherry. And before we leave, I just want to remind everyone that the slides will be sent out within 1 or 2 weeks. And I do want to share a comment by one of our hospitals. So Shelley stated that her hospital started Get With the Guidelines heart failure about 3 years ago, and they had a readmission rate at 38%. They are currently now down to 14%. This just shows the value of Get With the Guidelines heart failure and helping this hospital out. Thank you, Shelley, for sharing.
Oh, Shelley, you just warmed my heart, because this isn't, we're going to talk about awards, but that's not why we're doing this. You need to get this data in a timely way so that you can study what you're doing, and it sounds like you've done exactly that. That's wonderful work, and I know there are many others on the call who are doing that as well. So let us know how we can help you. We want to be your partner in doing that. So with that, we'll let you go. Thanks so much.
Have a wonderful day, everyone.